Hello, I'm Julie Gard, Dr. Gard from Auburn University. I'm going to talk on evaluation of an alternative therapy for infectious bovine keratoconjunctivitis. Everybody kind of knows what IBK is already. We call it pink eye, known to be caused by Moraxella bovis. It's considered the only gram-negative rod-shaped bacterium to cause central corneal ulceration. However, there have been some studies that have implicated some others. We know that irritation is necessary, so much as flies, wind, dust, sunlight, that predispose that bacterium to invade those tissues. Key features that we see: blepharospasm, conjunctivitis, lacrimation, discharge, corneal edema, and ulceration. Why does it matter? Well, because it's the most common ocular disease, but that's an estimated 150 million plus annual losses just on weight alone. 10 million calves plus affected yearly by it. So much as our traditional treatment has involved antibiotics, very good antibiotics that work well, oxytet, tetracycline, telithromycin, chloramphenicol. However, each of those require meat withdrawals and or with oxytetracycline milk. The others aren't to be utilized in veal calves or lactating dairy animals. Vaccinations, there are some vaccinations that are out there. However, Moraxella poses some problems with that cause vaccinations not to be as efficacious. Autogenous vaccines can be very efficacious because it's for that specific Moraxella that you're dealing with. So we wanted to look at an alternative method. The CDC, the World Health Organization, AVMA, FDA, are all encouraging development of alternative products that will not predispose to antimicrobial resistance. So evaluation of Vetericyn pink eye spray. Hypochlorous acid is the active ingredient. There's water and phosphates and sodium hypochlorite in there. They've shown that lab tests will kill 99.99% of M. bovis in lab tests. So we wanted to look at a clinical study. So our hypothesis was Vetericyn plus pink eye spray would aid in corneal healing, reduction of pain and infection in calves experimentally infected with M. bovis. So our experimental design was we had 30 dairy bull calves ranging in age from 2 weeks to 6 months. They had normal ophthalmic examinations. We actually had a boarded ophthalmologist do examinations on these calves, from Schirmer tear tests to the whole gamut. They were negative for culture for M. bovis. They were randomly assigned to 3 groups. So single eye blinded challenge study. We had 2 trials of sorts. It actually ended up, we wanted to do one large trial, but we did not have enough rooms in isolation, so we had to split it up into 2 trials. So 6 per group in the first trial and 4 per group in the second trial. All calves were kept in pairs at our Auburn University College of Vet Medicine SUG laboratory isolation facility. On day 0, the calves were anesthetized with xylazine, butorphanol, and a one-time dose of banamine at 1.1 mg per kg. The left cornea of each of the 20 calves were anesthetized with a topical 0.5% proparacaine. And then a central corneal lesion was made with inheptanol. We soaked Kim White discs, sterile Kim White discs, in inheptanol for a minute and then placed it on the cornea for 2 minutes to make this central lesion. We again stained it to make sure that it did make a lesion as well. Following lesion formation, we added 1 times 10 to the 7th of M. bovis, the strain EPP 63300 that had been previously utilized in some studies by Gould et al. In 2013. So there was already a model showing that this particular strain made central corneal lesions. So group 1 and 2 both had lesion formation and Moraxella bovis. Group 3 only received topical application of the M. bovis without the N-hyptanol-induced lesions. So it was an additional control group. Group 1 received 2 mils of Vetericyn, sprayed topically to each calf's cornea twice a day for 10 days. Group 2 received 2 mils of 0.9% saline topically to each calf's cornea twice a day for 10 days. We used saline because we wanted to, when we had to spray it in there, to account for the mechanical washing. Also, Vetericyn does have saline in it. Any kind of benefit that you might have for saline needed to be controlled for as well. Group 3 received nothing. Each animal was pain scored twice daily, utilizing a scale 1 to 4. Each animal was cultured once daily on days -7, 0, 1 through 5, and 10, and immediately sent to our microbiology lab for culture. Our pain scale went from 1, no pain, to 4, severe pain. All calves' corneas were fluorescein stained to ensure lesion formation in groups 1 and 2 and no lesion in group 3. The size of the lesion was daily assessed utilizing photography and ImageJ software. ImageJ is a program that very cool program that actually will allow you to take a picture, and if you have a scale on the picture, you have a set scale tool, then you can utilize that to circle the lesion as a metric rule to make it consistent from photograph to photograph. Wayne Rasband was the developer of this, and very good product. So this is just a picture showing you where you can circle the lesion, and you can set your scale tool on that, whether you're measuring area, circumference, height, and width, which we did in this protocol. Sample collection for chloride and sodium, and we collected sodium and chloride, or looked at sodium and chloride levels, because we were trying to see if there was anything that utilization of Vetericyn in the eye made any changes at all in levels of sodium and chloride. We didn't run an HPLC, but we figured that absorption or any effect that it might have levels we could detect. We also did urine, liver biopsies, fat biopsies, and muscle biopsies for chlorine testing as well to see if we could assess any changes within the tissues on utilizing this product. Ferret does not require any withdrawals for meat or milk in this product at all, but the company wanted to just be sure nothing was affected that we could detect. So testing for residues, the serum and plasma samples were tested at the Auburn University College of Vet Medicine ClinPath Lab for sodium chloride. Urine, muscle, liver, fat were all analyzed for chlorine using the DPD colorimetric method. And basically the reagent is added to the sample. Chlorine oxidizes the DPD to form 2 possible oxidation products. One is a magenta-colored compound known as Worcester dye. If you guys don't know your crayons, magenta is bright pink, so and a color's amine compound. So basically the intensity of that color is directly proportional to the chloride in the sample. So we measured that with the analytical instrument to look at the intensity of the color and converted it to milligrams per liter. So the result, all calves in group 1 and 2 developed lesions consistent with IBK in cattle. No calves in group 1 or group in Vetericyn group or the group 3 control were culture positive M. bovis after treatment. Only calves in group 2 were positive with M. bovis after treatment. Pain scores between days 1 and 2, group 1 had significantly decreased pain scores compared to controls, an average of 79.1% by day 2, and 83.7% by day 10. Group 2 also had reduced pain scores, 18.3% by day 2 and 67.9% by day 10. So we also took measurements, and this is just an example of C1 where we took measurements of the lesion width, height, area, and circumference, and compared to see at increments on how much that change was. Okay, so you can see lesions treated with Vetericyn Plus pink eye spray. This is day 0 when we created the lesion. Day 3, there was no visible lesion. Okay, this is an example of one of the saline control, and where we had a lesion. This is kind of dark, but there's a lesion there on day 0. And then you can see it's still present at day 6 with saline. So the statistics, data log transformed. Days to cure were significantly different. Same with lesion circumference. Days treatments and days were significantly different. Lesion width was significantly different. Lesion area tended towards significant. Lesion height. Treatments were not significantly different, but days were significantly different. Sodium chloride, all plasma and serum samples among all 3 groups were within normal range, no detectable difference. There was no difference between day 0 and post-treatment, day 11 and 17, in chloride within group 1 in the muscle, liver, fat, and urine samples. Cost comparisons, there is drug cost savings per se, utilizing Vetericyn pink eye spray. Of course, labor needs to be involved in this as well. Milk cost is not included in this as well. This is just the cost of antibiotic versus Vetericyn. So, conclusion, Vetericyn Plus pink eye spray can be utilized in aid in corneal healing and reduction of pain and infection in calves with experimentally induced and bovis infections. So.
Thank you very much, Dr. Gard. I think we've got time for one question. Has anybody got a question? Can we get a microphone over here, please?
Thank you very much. Francesco Testa from Italy. I could not understand when the treatment started. I understood the frequency, but I did not understand when did it start.
I'm sorry, I probably was not clear. The question is, when did the treatment start? 24 hours after infection. So we infected the eyes, and previously it only took 6 to 8 hours to induce an infection with M. bovis with that particular strain. So that's why we wanted to try to get infection. We waited for 24 hours. Thank you.
Thank you very much.